Governance, wicked challenges in healthcare. Healthcare in the UK is state-funded and is most certainly led by the way of a political manifest. However, the challenges in healthcare are by no means confined to the UK. The issue of governance in healthcare are complicated, and it won't be wrong to say it's a wicked challenge. A bit of information for our listeners around the globe. The NHS is one of the largest global employers with 1.2 million members of staff. On average, on any given day, there are well over 1.5 million patient contacts made with the health and care providers. The multi-layered bureaucracy, the hierarchical structure of the health system, with added misfortune of underinvestment, which is coupled with crippled capital restrictions and a mountain to climb in workforce issues, make for a perfect storm, resulting in poor outcomes for patients and the public. If it doesn't require good governance, what else does? I'm delighted to talk with Nabil Jamshed, who is recognized for his outstanding governance work in the largest trust in the National Health Service in the UK. Welcome to the Better Boards podcast series. I'm Dr. Sabine Dembkowski, founder and managing partner of Better Boards. We make the boards of the most ambitious organizations more effective. Our mission at Better Boards is to contribute to creating better boards. We do this by providing clients with an evidence-based approach for board evaluations and board development programs. Better Boards clients have access to an innovative digital platform that provides data and comparisons on all dimensions of effective boards, and the clients can use the platform for their internal as well as part of the external evaluation. To fulfill our mission, we give a voice to all who care about creating better boards. Nabil, it's fantastic to have you, and thank you so much for making time in a very busy period to contribute to the Better Boards podcast series.
Thank you, Sabine. It's a pleasure to be here to talk about what we can do in healthcare and in governance terms. So I'm really excited to talk to you guys today.
And we are absolutely thrilled to have you because it is a very hot topic, not only in the UK, in the countries across the globe. So what is it, Nabil, that makes governance in the healthcare sector so challenging?
I think if I may begin with, when we are looking at our journey in the healthcare provision, healthcare setup, healthcare landscape, healthcare as a system, healthcare as a service that we provide to our customers, clients, patients. Over the number of years, due to how our communities have grown, the complexities within that have grown at an equal, probably substantially higher amount. And that means that the healthcare becomes, and the governance within that becomes, a really wicked problem. To solve a wicked problem, you need to really think about what the solutions might look like and what those are. A wicked problem doesn't equate to wicked answer. A wicked problem equates to a simpler answer. And I think that's where the biggest challenge in the health sector is, that it has become a wicked problem to solve.
So what makes it so different in terms of the governance challenge to other industries? What do you think?
So as you know, in the UK, I'm talking about here in this specific, but I think you can relate that to many other countries in the same way. But in the UK, predominantly, the healthcare is funded through the state-funded approach, whereby you pay a certain amount towards your national insurance and you're provided the healthcare facilities, by and large, most of them at the point when you need them, free of charge to whoever needs it. So in other countries, when you think about the access of services and the demand of services, and again, back to the point of the complexity of the health and care needs, that's where the challenge becomes really superbly significant. Because the fact is, the traditional healthcare modelling, where the healthcare was seen as delivery of services out of hospital only, when you have a problem, you go and see your consultant or you go and visit a hospital, doesn't quite work. Because the fact is, how we are living our lives is very different to how we used to. And within that, when we think about our habits, our communities, our social constructs, all of that has changed. And that means our lifestyle is very different. So the health and care needs, I do want to emphasize on they're two different things. So health and care needs are two different things. When you combine the two together and think about the delivery models, the governance has to address it in its holistic sense, thinking about the citizens before the people. By that, what I mean is you're looking about the needs of the population that exist in a community, whatever that community might look like, and what those health and care needs are. And in that, the care needs is really absolutely vital. When you look at World Health Organization's manifesto, the health and care only appears like probably 2 lines on page 20. All the other socioeconomic factors we know are the significant contributors to a person's health and care needs. If we don't address them right at the start in a partnership model, working with the agencies involved, having a robust governance with clear-cut accountability, responsibility, and roles defined, we will not be able to deliver that we need to deliver the best service to the patients who we serve. So that's where the governance challenge is. And that's why it's so different. In any healthcare setting, when you look at any country, they are faced with exactly the same challenge of access, of population health needs, of inequity, of the desired outcome of the population health and health inequality within that. How do you actually embark on the journey to resolve it? The answer has to be a robust, effective, sexy governance. Other than that, nothing will work.
I like sexy governance, actually. So where do traditional governance models, where do they fail in your view? What do they really not address?
So I think I'm a big fan of Professor Nadler. And when you think about the analogy that's used, is think about governance in different ways. So there are many schools of thoughts within that. There are many different approaches to governance. And there's an absolute need for the mechanical aspect of governance. By that, what I mean by and large, looking at the meeting the minimal compliance regime to whatever industry you are serving in, you will have standards to abide to. You'll need to ensure you are working within a safe environment, you're producing a high quality product. You'll have kind of a checklists to go through. You will then support those checklists by having a wiring diagrams that I call in my head, which are, again, the mechanical parts of governance. They're like the gears within a watch. They're clicking at a certain rhythm. Your committee A meets, that feeds into committee B, which feeds then into committee C, which then feeds into your board. They all are happening at the right time. That all rhythmic work has to be there. I'm not saying it doesn't have to be there. However, where the traditional governance has failed is people have just understood governance is just about that. It really isn't. Without having a clear-cut vision, without having a clear-cut strategy that is looking with the lens and eye of the decisions that we would take today, the impact of it in 5 years down the line. If your strategy doesn't address that and is not formed with that view, you will not be able to unpack what the leadership needs in that delivery of that strategy means. You will not be able to understand how would you define your risk appetite as a board, as a collective unitary board. What is the risk appetite I want to proceed on? So let's say if our population is changing, healthcare needs are changing, as we talked earlier. We know that if not 5 years, 10 years, 20 years down the line, a lot of the delivery will be replaced by the AI or the robotics. Now, what does that actually mean? So when we think about it, so the decision we are making today, we are saying, okay, we want to heavily invest in innovation, and we set a risk appetite accordingly to say we want to be really up in front with open risk appetite for innovation. And then equally, you will see the board saying, well, actually, I will have very conservative view on my finances because financials are crunch. We all know the crisis we are faced with. So how do you actually ensure that balance? And when it comes to presenting the board and organizations with decisions to be made, how do you actually ensure that that risk appetite is translated? So that's what the governance is all really about. And that's where the traditional models fail, because they don't actually emphasize enough on the softer aspects of governance and focuses a lot more on the compliance aspects of it. When you look at what's happening in FTSE 100 to 50 or whatever, the regulations, the standards are coming out of our ears, which is good. I'm not saying it's bad. It is good to standardize processes and ensuring compliance against that. But there's a but and so what. Unless we address that but and so what, the traditional governance and the governance per se will fail. And henceforth, the governance has to change and adapt to the new models, to the modern governance approaches, as King 4 talks about quite largely, in an integrated way, where you're looking at the cross impact of one area of business to the other and the rest of the organization and up and down the chain and within the system that you operate with your partners' impact considered and approached. Without that, if you don't take a holistic approach and everybody on a journey, the governance in the traditional way will fail. It just will fail because it will have not support systems that it needs.
I couldn't agree more. I mean, this is what we are seeing in the board evaluations, actually. This is also why typical box ticking exercises very often fail and don't answer the question if this is really an effective board. So the big question is how to do it. We might have lots of listeners who say now, yeah, sounds good. I actually agree. But how do you make it happen? And in the largest trust in the UK, you have actually implemented a different design for which you got a lot of credit for.
Yeah, that's $1 million question, is the how. And when we think about the how that I've implemented here in Guy's and St. Thomas's, which, as you know, is the largest trust in the country and also probably the largest in Europe, the answers we are trying to develop, we haven't got the answer yet, but we are trying to develop, is going to be very different to any other's answers. However, when you stick to the principles of the framework in that governance modeling, what I call the sexy governance, you can't go wrong. Really, you can't go wrong. So for instance, I'll give an example. So when we were looking at this work to think about, okay, we need to work in a partnership approach in the delivery of health and care for the communities that we serve, the citizens of London. When you think about it, if you just go onto Jubilee Line, for example, you go from one station to the other, which is no more than 5 minutes down the line, and you're heading towards south, what happens is your life expectancy reduces by 5 years by each stop. Quite literally, it does. By the time you reach Stratford from London, you're looking at a health inequality life expectancy gap of about 15 to 20 years compared with London folk. You can imagine the magnitude of that problem. And how do you actually ensure that you deliver a comprehensive, holistic health and care needs to address that inequality? What can you do? What you can do is each organization within that have got a role, a significant role to play to think about the basic principles of modern governance has to be apply and explain. It can't be comply and explain. It can't be anywhere else at all. It has to be apply and explain. By that, what I mean is, so when we were looking at the modeling of it, so we looked at the principles set out by King 4 and looked at his approach to integrated reporting and applied that knowledge in a slightly different way. So King talks about his 6 capitals quite elaborately, which is a fantastic way of looking at it. And it is a really valuable framework to follow through. I'm a big fan of that personally, and it addresses at a certain level. But when you look at healthcare and especially state-funded healthcare in the NHS, as it is, applying that, we had to come up with our own 6 capitals or 5 capitals or 4 capitals, whatever that may be. What are the key things that makes your organization a success? So for us, for example, we knew that we cannot compromise the quality and safety of the care that we provide to our clients. That is our utmost, absolute 100% commitment and energy behind it. Whatever it takes, be it we go skew on our money, we go skew on our finances or whatever, what we can't do is compromise the quality and safety of the care that we deliver. That's one of our biggest capital. We wanted to understand what that means. We then unpacked how do we actually deliver that is through our people, as in the people we employ. Within that, do we actually ensure that we have the workforce that is representative of the population we serve, and the modeling is right to deliver the care and healthcare needs of the population that we serve? Again, a big contributor, another capital that we call as a capital. We then look at finances as in terms of use of resources. So not a typical finance to say, oh, month 5 report is now producing X amount of money and we are off kilter in achieving our financial balance. But the actual asking the question about what does that actually mean? So if you are saying that our finances are out of kilter for whatever reason that may be, the key question you need to be asking in that model is, what is the impact of it on the provision of the quality commitment that I've made? What is the impact of it on the people commitment I've made? What is the impact of it in achieving our regulatory standards that we need to meet? You need to understand that unless you create that integrated approach, a single thread modeling that looks at those individual capitals for the impact assessment on its own entirety, but equally at the same time, it goes sideways where it assesses cross tabulation of impact assessment on each other. Unless you achieve that, the delivery of the care will be pointless. It will be meaningless because you'll be just talking in silos. We need to break those silos. We need to apply and explain the principles of governance, ensure that agility is developed within our leadership modeling, in our vision, in our delivery of care, and ensure that it is driven through the front line. What we've done really successfully here in one part within the Gaz and St. Thomas's is to ensure that the clinical voice and the clinical people who understand the clinical needs are in the leadership positions. They are the lead accountable people for the delivery of the services that they own. And they look at this modeling in an integrated way. And we provide the governance and allow and empower the governance for them to do this. Otherwise, we will just fail. So that's just one example. And when you then think about how do you actually use, for example, in the same modeling, we used co-production. But when you look at co-production, for instance, its general sense, co-production is used to find a solution to a problem. How we applied co-production is to find the real problem, unless you know the exam question that you're trying to answer. So we co-produced the exam question alongside with our clinical colleagues and management colleagues in a collaborative way, extending it to our partners to understand what is that exam question we're trying to answer. Unless you do that, you just will fail. Your governance will be meaningless, and meaningless governance is not governance. Meaningful governance is governance, and that's where it's sexy.
So how do you make sure that the non-executive directors, the people on your board, actually understand this complexity and all this modeling you are doing?
Again, a really, really good question. So the approach we took here is, so when you try and unpack the governance, the key elements when you have your non-executives involved versus your executives, they have two different lenses. So executives will focus on the operational delivery as such of whatever the services might be. Whereas the non-execs will be thinking about, how do I get assurance about that everything is happening as it should happen and there are no loopholes and we are not going to expose the organization to a significant risk. So what we tried and do was to model our governance structure from the assurance committees fixated on those capitals. So every single committee will lead on one or two or combination of capitals, and they will have responsibility to respond against that. And in that, the provision of assurance from the executive committees goes to those senior board committees. And that's how the linkage worked. From our operational delivery, what we have implemented is big old, very commonly used management line reporting model. We call it performance review meeting process. What that is we've got a number of very complex services, about 94 of them, which are then categorized into 8 different directorates. How do we ensure that when they are looking at their business on a regular basis is seen with those capitals? So the structures we follow through within the operational delivery in the bottom-up approach was also designed to report against those 6 capitals, but with an operational lens. When you join the two together, that gives you that assurance modeling. Now, the key question that we were faced with within that was to think about, when we are talking about this language of assurance, people were hearing the word performance. And that's where it got really, really interesting, because you need to be able to differentiate between the two things, which are very, very different things. When we think about assurance, at least from my point of view, with the school of thought I come from, the assurance has to be based upon a triangulation of assurance from various different sources. Your data, your performance data on key indicators is only one aspect of it. And I give this example to my colleagues all the time to say, when you look at any football match, for example, recent World Cup, you pick up any match within that, more or less, the side that has the most possession, the side that has the most attacking, the side that were looking like in control of the game all the way through didn't actually win. So we have to really pay attention to that element, that detail of it, to say the evidence should speak for it, absolutely. So the KPIs might give you one aspect of what it is, but you need to build in your software intelligence. You need to think about, what does it mean for our patients or the clients that we serve in whatever setting you're working in? What does it actually mean? And that ownership of taking the stewardship modeling, I think that's an absolute mission critical factor. If we don't deliver against the stewardship modeling and steward modeling within the governance, what are we there for? I think that's the key question we all should be asking. And then we must be really paying attention to what that means. That has to be delivered. So the new guidance on stewardship I find is superbly useful when you look at it and think about, you need to bring people on that journey. You need to ensure they are there with you. So you need to build that assurance model that includes fully comprehensively the data elements, plus your software intelligence from the patients you serve, and what is your staff telling you. You need to build on that into the software and hardware elements. And I think within that, when you think about, so why do you do this? People ask me, why do you invest so heavily in thinking about the software elements? When you actually think about it, I'm sure you all would have heard it in many different ways. An absence of evidence is not evidence of absence. And we just need to pay attention to that quite rigorously to think about it. What is the evidence are we looking at? Is there something absent? What are the unknown unknowns? And that's where you become with an analogy of governance that is sexier, which is more effective, that is conducive, and that is making difference to people's life.
So Nabil, tell us, that is fantastic information. And I would say it's not only true for the healthcare sector, by the way. How do you think your board papers differ? Because you talk here about very different outcomes. Do you think you provide a different input to board meetings? Is a standard or is typically done?
Yes. So I think we are on a journey. So we are implementing it as we speak today. We haven't quite nailed it yet. But when you look at the board pack per se, you may notice that information that we produce is now all aligned to those 6 capitals. Any single report that comes to the board is aligned to those 6 capitals. Right at the front sheet that we know are part and parcel of our board, ask that question about that impact assessment of this report on those 6 key capitals. What is it? It then asks about the linkage to your strategy and your leadership and your vision and all the rest of it, which needs to be filled in. It thinks about the quality impact assessment. And one of the really fantastically brilliant model that I'm really proud of we have introduced is I call a AAA model. Within each report, we have these 3 A's question. The first A is, what do we want the committee or the board to be alerted to? The second A is about, what do we want to provide the board and the committee assurance with? And the third A is about, what actions are we taking to address it going forward? And you can build as many A's as you wish, but those are the 3 A's that works for us. So every single report that comes to the board covers those elements. That's one aspect that you see change. But the real change is in the discussions held at the committees, at those local feeder groups, which is an absolute bottom-up approach. Without that subsidized governance approach, you can't achieve this, by the way. So what we've done is, when we look at our agendas of those, some of the feeder groups, I call them, they're no longer thinking about month 5 performance report, month 6 workforce report, etc., etc., etc. What it does, it asks a question to say, we are having a negative impact due to a significant increase in violence and aggression incidents. What are we doing about it? Agenda is on questions. And we applied some of the modeling from Nancy Klein with my really good colleague that I've been working with, Mitzi. If you want to have a look, please do. But Nancy Klein's work is all about the thinking space. So what we tried and do was to build into our executives a place for them to hold this thinking discussion where the focus of attention before they come to the meeting, they're pre-prepared about the questions that we are asking. So they're no longer presenting a finance report, literally line by line, that, my capital expenditure is this, my pay expenditure is that, la, 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 la. They don't. They answer the question to say, okay, I've got a significant problem in my spend on whatever. What does that mean and how I'm going to resolve it? That's where the discussions have changed. Similarly, for the quality aspect, we've done exactly the same way. We've asked that challenge and that question. But again, without the bottom feed up approach, with the top down commitment, without the mechanical governance combined into all this, without looking at the 6 capitals at every single time, you can't do that. And what we try and do was we introduce this new group committee, whatever you want to call it, a discussion place, what I call Integrated Governance Assurance and Performance Meeting, IGAP. The reason IGAP is because it fills in a gap in our thinking ability. What it does, it sucks in all that information from all those angles, all those feeder groups upwards to the executives, and gives them that flavor of triangulation of those themes that are right across the organization, where there are multiple avenues of our leadership structure are affected. What are those 3 things for this month? Let's look at them. Let's work together to find a solution. Let's learn from each other. That's, again, where the value is driven. So without doing that cross-fertilization, you will be just repeating yourself 10 times again. So we've stopped doing all of that. And that's why we become effective. and efficient and sexier governance. So I think that's one of the key things we really want to progress forward. And hopefully as we go on that journey, we will see more changes in how we present our information to the board, providing that lens of triangulation.
Nabil, that was a fantastic description, and I can only repeat it. What you described there, I think, can be a real solution for the healthcare sector, but going far, far beyond. And I hope that also listeners from many other industries will think about what you described. We sadly have to come to an end, and we always end with a question: what are the 3 things our listeners should take away from this podcast?
I think there really is a lot in it. I think 3 things that I would want to say is, firstly, have a very clear-cut strategy, a long-term strategy. What I've learned through my 20 years odd working in governance is we have to believe in the process. We have to believe in the process. And that process is enabling us to deliver what we need to deliver. Unless you have a clear-cut strategy, which is a long-term, i.e. 10, 20 years output of what you want to achieve, you will not go on that journey. So have that strategy absolutely clear-cut from the start. Stick to it. Regardless of the changes, stick to it. Believe in the process. It will deliver. The second thing I want to say is build your agility in your governance to what it needs to deliver. So link it to your strategy, link it to the risks that you identify through that process, but build that agility. Build the apply and explain principles. Don't get hung up on to say that one size fits all. Don't get hung up on the compliance only. I'm sure of it. If you are able to show a different way to comply to a requirement, then that becomes a more useful, conducive way of showing how you are performing against that. So think about how would you apply and explain the requirements that are laid out. And I think the last thing I want to say is, we started off with that it is a wicked challenge. It is a wicked problem that we face. And the answer can only be a simpler. I'm a big influenced by the book I read some time ago. It's called Frugal Innovation by Joydeep Prabhu. When you look at that book, it talks about the jugaad, the frugal nature of innovation. And I think the lessons in that is probably can be summed up into one line. And that one line is, in our lives, in the work we do, we are faced with complex problems. Complex problems do not mean a complex solution. It means a simple solution, but that simple solution doesn't mean in the background the complexities are avoided. You understand those complexities, you address those complexities and build your governance to simplify those complexities into a simplification way. Unless you do that, this will mean nothing. So the governance has to be meaningful. It has to focus on those elements. So those are the 3 things I would leave the audience with.
Thank you so much, Nabil. It is very clear that you are truly passionate about good governance, and you provided us with so many insights and practical tips what you are doing to improve governance in the healthcare sector. So a big, big thank you to you for making time. It's a very, very busy period in the healthcare sector as we are recording. So thank you so much for making time.
Well, thank you so much for giving me the opportunity. I'm glad to be able to share some thoughts, and please do get engaged. I'm more than happy to talk to anybody who wish to live, breathe, eat, sleep governance. So please do get in touch.
Thank you, Nabil.
Thank you.
As always, please do not hesitate to get in touch. If you have a comment on this podcast, if you have a suggestion for a topic, or if you would like to learn more about our work and book a demo for the Better Boards board evaluation platform. You can best reach us at info@better-boards.com. Thank you for listening.